My name is Lexi Wright. I'm going to be performing the IV insertion skill. First, I'm going to state my 12 rights. I'm going to verify the care order for my patient, verify facility policy and procedure and gather appropriate equipment and supplies, consult manufacturer's recommendation when equipment is involved, perform hand hygiene before and after any patient care or handling equipment, knock on my patient's door, identify the patient using 2 identifiers, note overall condition of the patient. I'm going to elevate the bed for good body mechanics, explain procedure and provide for privacy. I'm going to don PPE if indicated. Upon completion, I'm going to lower the bed and raise the side rails according to the patient's care plan, and if there are any abnormal findings, I'm going to report those to the charge nurse immediately. So I'm going to be applying the tourniquet to Michaela Wharton, but inserting the IV catheter into my celery stick. So before starting the procedure, I have all my supplies ready. I have my normal saline with my catheter extension connected. I've got my catheter. I've got my ChloraPrep to clean her skin, my tape to stabilize the catheter. I have my Tegaderm. I'll put my name, date, and time of insertion. I'll also put the catheter gauge. And then I also have my gloves. So I'm going to put this on her to see and find the vein that I'm going to insert the catheter into. So that's that. And then whenever I say that I'm going to release the tourniquet, that's how I would do it. Just like that. Okay. So now I'm going to insert the catheter on my piece of celery, so I'll make sure my hands are clean prior to starting. I have my tourniquet on it. I'm going to palpate to find the vein, so I'll find a good vein. I'll also check the radial pulse to make sure that there's good blood flow here. So, have that. My ChloraPrep, I'm going to clean the patient's skin. I'm going to go in a horizontal motion with friction and then vertically and in a circular motion for 30 seconds. So, patient skin is clean. I'm going to put my gloves on. Okay, so I've got my gloves on. I'm not going to touch the site again. I'm going to get my catheter ready. I'm going to check the needle for catheter integrity, needle integrity. I'm going to make sure that it's not broken. It looks good, so I can use this one. I'm going to apply friction up here, and down here I'm going to pull the skin kind of taut. I'm going to prepare the patient. You're going to feel a quick stick poke. I'm going to insert the catheter at a 10 to 30 degree angle, bevel up. So you'll feel a poke here. Now if this was a real patient, we would see blood return in the catheter hub, which is what I'm looking for. So I'll say I see blood in the catheter hub, so I'm going to level it out with the skin. Still applying that pressure to the skin, and then push it in another 1/4 of an inch, and I'm going to remove the needle, make sure it clicks safety, and this will go directly into a sharps container, so I can act like this is my sharps container. So my catheter is in there. Now I'm going to connect my normal saline. Okay, so I've got that connected. I'm going to use my tape here to stabilize the catheter. Catheter is stabilized. Now I will flush the catheter to make sure that it is patent and usable. So flush. And as I do this, I'm going to check for swelling at the site, anything like that, so it looks good and we can use that. Now I'm going to apply my Tegaderm over the site, and that is my skill.